My name is Olayonjo, and this is my husband.
Adebilo.
I was diagnosed with polyhydramnios. Then, during the process, I went for an anomaly scan, which the doctor discovered I had my baby had esophageal atresia. So I went back to my hospital, and I was told the baby will have to undergo a surgery after birth. But during the process, there wasn't like a pediatric surgeon in the hospital where I was registered. So my consultant and my doctor referred me to Evercare Hospital. So before delivery, I already registered here. Then I met with Dr. Fatima and Dr. Arua Igwe Obasi.
I was scared when I heard about the diagnosis, and I came in to meet Dr. Awa, and he assured me. But on the other end, I was quite scared because he said the baby has 20% chance of survival.
Bello, I met her for the first time when she was still in her mother's womb. She presented at 30 weeks of pregnancy. The mother did a prenatal ultrasound, which suggested that there was a discontinuity in the esophagus, such that there was excessive amniotic fluid in her mother's womb. There was also absence of the stomach bubble, which is very, very suggestive of esophageal atresia. So we had to counsel the mother on the possible time of delivery and the course of the management of this baby.
When I heard you have to undergo esophageal atresia surgery, at first I felt very bad. But on the other hand, when my doctor referred me to Evercare Hospital, I had to go through the Instagram pages, I went through their doctors' pages, including the pediatric surgeon's page and everything, to make sure I was on the safer side. I felt very comfortable at a point. So when I put to bed, my baby was brought in immediately, and the surgery was done.
At the second day of life, we had to repair the esophagus, to reconnect the esophagus. So she had minimal access surgery, that thoracoscopic repair of the esophageal atresia, where we use minimal access technique to go into the chest and reconnect the disconnected esophagus. So the surgery went well, and the baby tolerated the procedure very well. She was placed on mechanical ventilation because of the distance between the two esophagus was quite long. So the anastomosis was under some degree of tension, and we had to place her on ventilator for a while to allow healing. After about 10 days, she had a barium swallow, which showed an X-ray done, a special X-ray done, which showed that the esophagus was well connected and was functioning. Then we started feeding her through the mouth.
My baby was at the NICU for 34 days. Then on the last day, I had to come in for rooming. The doctors needed me to take care of her in their presence to be sure I could be able to take care of her at home. So then we were discharged after then.
So hopefully we are expecting the baby to grow up normally. As at today, the baby is swallowing without difficulty and achieving full feeds without difficulty. So we expect her to grow up normally and achieve her normal weight as she grows. We'll continue to monitor and see her frequently in the clinic and monitor her growth and her swallowing.
So, well, I'm actually happy now seeing my baby, and the journey has been good.
Okay, concerning esophageal atresia, generally in our country, the mortality rate has been quite high, especially because of lack of facility to manage these patients post-operatively. We have a mortality rate of at least up to 70 to 80% in most tertiary hospitals in our country. However, in Evercare, because of the extreme collaboration of all the specialties, and the presence of adequate facilities to manage these children, we have recorded good success. At least we've done 2 cases today, and both of them have gone home and they are eating very well and growing very well.